Hi, everyone. My name is Elise Hugh. You are joining us for one of the UCLA Connections, where we're bringing UCLA experts on topics you care about during this weird, difficult time that we're all collectively going through right now. My name is Elise. Again, I am the host of the TED Talks Daily podcast, which I hope you're listening to, and a host at large at NPR here in Culver City. If you have any questions during this session, we're going to go about 25 to 30 minutes. And during the final 5 to 10 minutes or so, I want to weave in a bunch of questions that we've gotten from some of you all already in advance, and then those of you who might have questions as we get this conversation going. So if you have any questions as we're kind of talking and you want to ask them, you can tweet me at ELISE WHO. You can tweet me at ELISEWHO. Just a couple of housekeeping notes. This webinar is being recorded, so only myself and today's guest are going to be recorded. You as the audience, those of you who are joining us today, will not be recorded. And if you are in the audience, the chat and the Q&A are also disabled, so you can feel safe knowing that your mics are muted and the video is turned off. And again, the recorded discussion is going to be available later. We are saving this so that if you aren't catching all of this, you can catch it later at ucla.edu/connections. All right, without further ado, today I'm super excited to have a conversation with Dr. Lara Ray, who heads the UCLA Addictions Lab, among her many other titles and accolades. Hi, Dr. Ray.
Hi, Elise. I'm happy to be here. How are you?
I'm great. Thank you so much for joining us. There's a lot of folks interested in this topic and your area of expertise. So I just want to start off by asking, because we are all coping through this difficult time, do you know if people are drinking more these days? I mean, is there any data on this?
Yes, we're starting to gather data that people are using alcohol to cope. We know that under stressful conditions, people tend to drink more. And unfortunately, that's one of the many consequences of COVID-19. People are drinking more to cope.
We are all experiencing this collective grief and fear and anxiety. So can you talk to me a little bit about what the relationship is between anxiety, say, and the tendency to fall into more problematic drinking?
Sure. So alcohol functions really to relieve anxiety. Alcohol has pharmacology that's very similar to a benzodiazepine, to like Xanax. It works on the GABA receptors in the brain. So what's really happening is that through experience, we learn that alcohol has anxiolytic or anti-anxiety properties. And we learned that we can use alcohol in high anxiety situations. So one of the things we see, Elise, is, for example, people who are very socially anxious, they're going to rely on alcohol in social situations.
So that would lead us to, I guess that leads me to assume that we're collectively kind of self-medicating, right?
Unfortunately, so. I would agree with that. I think collectively we're coping and we're trying to do the best that we can, but a lot of us are using alcohol as a coping mechanism, and some of us to excess.
What should we do about it?
Well, one question that I want to pose for everyone who's listening is, if you're not using alcohol to cope, then what? Okay, because we need coping strategies right now. We are all living through this very unprecedented, unpredictable, very anxiety-provoking time. So what I would challenge everyone who's listening is to ask the question, if I don't use those drinks at night to calm myself down, what else can I do? What are some healthy coping strategies?
And I look forward to talking about those healthy coping strategies, not just for myself, but for everybody throughout this conversation. Is there anything that you're anecdotally seeing as a result of not having external places to go where lots of folks used to go get together with friends to imbibe? So how has the closure of bars and restaurants, for example, affected drinking habits?
Yes, the social aspects of drinking have changed dramatically because we live in social distancing times. So I completely agree that folks are not drinking in those social settings. However, they continue to drink for different reasons. So I think what we're seeing right now is that folks who are drinking at home, they might be drinking with a partner, they might be drinking with a significant other. You know, there's a lot of ways in which people are using, they're doing Zoom happy hours.
Mhm.
So there's a lot of ways in which people are keeping some of that social component to a much lesser extent. However, you know, as I said earlier, alcohol does have those anti-anxiety and anxiolytic properties. And in such an anxious time, I'm worried that folks are over-relying on it.
I wonder, you know, and I think this might be a test that a lot of us would probably have to give ourselves. How do you know? And because you treat addiction for a living, and maybe it's less, you know, awareness for ourselves and more keeping an eye on our loved ones, right? How do you know when, you know, drinking to cope in a healthy way or a way that's not abusing alcohol tips into something that's more problematic or alcohol abuse?
That's a great question. One of the things that I want to offer to our listeners is we have a couple of benchmarks that we use to basically draw a line in the sand about what constitutes sub-problematic drinking and what starts to go into the hazardous drinking category. So I'd like to share that with you because it's something that we can look for. There are different guidelines for men and women. So for women, 7 or more drinks a week would put you in a hazardous drinking category. So one of the ways that you can watch your consumption of alcohol is really trying to stay below that 7 drinks per week number. For men, that number jumps to 14. So trying to stay under 14 drinks per week would be a reasonable goal.
Is it different? I guess, how do treatment options differ, right? So for folks on different stages of that spectrum, right, of problematic drinking. So how do you treat folks on one end of the spectrum, which might just be sort of some problematic, as you say, versus those who might be physically addicted to alcohol, where your body would actually react if you withdraw and go through withdrawal symptoms if you had to stop? Is the treatment generally the same, or is it tailored for different folks who are on the spectrum or different positions on the spectrum?
That's a great question. Essentially, we have different treatments for folks at different stages, and we have what we're talking about is folks who drink socially, who are now finding their drinking to exacerbate. And then we have individuals who are in recovery who are doing their very best to stay in recovery. Their recovery challenge. This is my daughter, Gabrielle.
Oh, yay! We have a Zoom bomber.
UCLA outfit over here. And that's the extent of her participation, is to show her UCLA.
It's not a good Zoom webinar without a proper Zoom bomb by one of our kids. So it's no sweat. I've got 3 of them.
Oh, thank you. I have 3 as well. Gabby, I'm going to walk you to the door, okay? And I'll be right back, Elise.
Fantastic. So folks who are listening, if you have any questions about this conversation so far, you can always tweet at me at Elise Who, ELISEWHO. We're just getting going with Dr. Lara Ray, who is the director of the UCLA Addictions Lab. So, and I'm glad that we're on this topic right now, because I'm curious, for those who haven't had alcoholism in our immediate families or in our lives, how treatment does differ.
Absolutely. So one thing is that, just as I asked earlier, you know, if not drinking, then what? What I would say to those who are trying to cope and who do have a problem right now is that we want to see, where are the sources of treatment and recovery coming from? So in-person meetings at AA are not an option, but we know that virtual meetings are happening. In fact, some people might be attending more meetings than ever before because they're more accessible through Zoom and other platforms. Likewise, telehealth is happening more than ever. So this is not a reason not to call your provider. Call your provider. Continue to do the things that are accessible to you to maintain your recovery. They're going to
How
look different.
Yeah, how important is or are those in-person meetings to recovering alcoholics? So, for example, if you are part of the AA program or SMART meetings, those sorts of things where you can get together with other folks who are in recovery, now that's been stripped away. And I understand that there's Zoom, but how important was that sort of sense of community to folks? Do your patients talk about that and what's lacking now?
Absolutely. That's a great point. Patients do talk about that. There's something very profound about being in the presence of individuals who have a similar struggle. And we know that the science of AA and 12-step facilitation supports its efficacy. It is a highly efficacious treatment, especially for people who have very serve kind of resources around them for social support. So if everyone is drinking around them, where do they go for sober support network? And AA fills a major gap in that area.
Yeah. So without it, how are folks doing? How are you counseling those who are in recovery, which number in the millions among Americans?
Absolutely. We're very concerned because what we're trying to do is our best to learn telehealth and implement telehealth. So much like the teachers at LAUSD are learning to provide education online, many providers are learning to provide services online and trying to be as effective as they can. So one of the things that we do is we continue to cope. We continue to support our patients in having coping strategies and adapting those coping strategies to what's accessible right now. With a lot of my patients, I'm talking about getting physical activity. We're talking about attending remote meetings. We're talking about taking all alcohol out of the house. That's a very simple but effective strategy that I'm looking for people to implement. If you want to drink less, you start by going through your fridge.
I want to hear stories or just general anecdotes. Obviously, you don't want to get too specific, but what are you hearing? What are you hearing about from folks who are battling addiction or not even that far along, but just having to cope with this time and wanting to do so by drinking?
You know what I'm hearing a lot? I'm hearing a lot from folks who are in recovery and patients that I treated maybe a year ago or 2 years ago. They seem to really be calling back and saying, what now? So
Yeah.
I think a lot of folks are feeling like, you know, my recovery is in jeopardy. What can we do together to make this better? And, you know, I, as a therapist who believes in treatment, you know, want to remain optimistic, want to remain supportive and positive. And a lot of what we're doing is problem solving. We have this major problem of changes in access to care, and we have to problem solve together. And that's a big part of what I'm really doing with my patients is problem solving and, you know, eliciting some of those coping strategies.
How have you had to creatively, do you have a good example of this? Any sort of creative solutions to help your patients that maybe could apply more universally?
Yeah, you know, a lot of it we elicit from patients, so they come up with their own things. So they will come up with things like if they want to do a Zoom happy hour, but they don't want to look like they're not drinking, they'll pour a non-alcoholic beer, and
Okay.
they, you know, participate. They want to participate in social settings, but that's a very challenging situation for a patient. I think a lot of patients are also looking to what's out there in terms of medications. You know, I think there are lots of good alternatives that we want people to try. So I've been talking to patients and counseling them to get prescribers and consider medications that can be helpful to them. We've been problem solving around alone time. Being alone is such a trigger. So we're really trying to talk about ways in which people can feel supported and connected. And even, you know, busy households having time alone, spouses being together, going for a walk together, that seems to be really powerful and will take all that we can get right now.
Is there any sort of best practice that has emerged during this period of COVID? Obviously, this has just been a ripe period for all sorts of scientists because it's a lot of experimentation is going on. So has anything emerged? It's only been 10 weeks or so, so maybe it is too early, and I don't know how scientific some of the testing is, but has anything emerged as a best practice that seems to be effective in this highly stressful time?
The number one thing that all providers are working on is to be available. We cannot disappear from our patients' lives. We have to be available. We have a duty to serve and to work with the communities who need us. So one of the major efforts really that I've seen in our clinic at UCLA and other clinics is to be present, to show up for our clients, for our patients, and making sure that they know services are still available. One of the things we're very worried about is everyone is afraid of any hospital setting or any medical setting. So people are getting less than optimal care for a lot of conditions that need attention. That is very true for addiction. Don't give up on your appointments. Don't give up on pursuing telehealth. It's a learning curve, but it's worth it. So we're spending a lot of time on just being present and showing up for our patients.
How do we help each other? So how do we help our loved ones or reach out to folks who might be isolating alone? Obviously, you have family, I have family, that helps a little bit, but for our friends who are or single parents, you know, who are going through this quarantine period by themselves and maybe at risk for falling into an addiction or in recovery, how do we reach out and support one another, even though we're not therapists?
Yeah, well, that's a great question. I think that really having frequent contact is so important. And if you can't be on the phone, at least texting, communicating, we're all really looking forward to those times when we feel connected. And so frequent contact is really powerful, really important. I encourage you, if you have a loved one that you're concerned about, make an effort, maybe even schedule a time. If everyone is obviously so busy trying to cope, find a time. Can we make a daily call time when we're going to check in and be together? That could be a really useful alternative.
Can you talk to me about why that frequency is important? Because I think like when this first quarantine or when the quarantine first started, there were some articles about how people were reaching out to their ex-partners, you know, ex-spouses or ex-boyfriends and girlfriends a lot. And there was this sense that, oh my gosh, you know, we're in this highly stressful time and reaching out, but not in a really concentrated way. Because you're talking about, hey, let's put something on the calendar and make this a regular check-in. Why is frequency important psychologically?
Well, psychologically, what you're doing with activities, you're building pillars of recovery. When you don't have substance use in your life, you're filling that time, you're filling that space with healthy activities. And so I see those frequent contacts, frequent walks, frequent plans as pillars of recovery. They look a little different now, but we should try to maintain as much as possible recovery pillars, and they keep us on track. We know that people who have a schedule, who wake up at the same time, go to bed at the same time, do much better in regulating their mood and their drinking. So we want to create structure and we want to have those pillars in place.
And let's talk about loved ones again. So if you are living with somebody who might be an alcoholic, or you're living with somebody who abuses alcohol and maybe doesn't know it or admit it, how do you manage life?
That's a great question. And the first thing I'm going to say to all of our listeners who might be in that situation is that do not take it upon yourself to fix the problem. Do not take personal responsibility for a problem that is not a couple's problem, it's an individual problem. It resides in the person who is over-consuming alcohol. So we hear a lot about enabling, we hear codependency. I do not believe in those terms at all. I think that people are trying to make healthy adjustments and they're trying to do the best that they can. So I do think that loved ones those who have a loved one who's drinking too much is not enabling, it's really adjusting to try to cope. So I have a very favorable, positive view towards those spouses and partners.
And if you are in a quarantine situation like this, Besides, so you're saying just to remember, of course, not to blame, you know, if the spouse or the love or the daughter or whoever it might be of somebody who's an alcoholic should not blame themselves or take responsibility for it. But you still do have to manage life with somebody like this, right? And so what is your message? What can you do as a loved one of somebody who abuses alcohol short of taking responsibility for it?
Sure. I think, one example that I really like is, say someone has a partner who's drinking too much, and this person says, you know what, you're not going to pick up the children. I'm not comfortable with you driving with children in the car when you drink so much, right? I don't see that as enabling. I see this as a healthy adjustment. So in the home, I might look to make similar healthy adjustments in the way of protecting the home environment, because drinking in and of itself might be a personal choice. However, it can impact the home environment in very dramatic ways, with arguments, with fights, and oftentimes with domestic violence. So we have to be really careful that we are taking measures to really protect everyone in the home so that drinking doesn't escalate into these unfortunate consequences, and it often does.
All right, we have less than 10 minutes left, so I want to get to some of the questions that have come in advance of this. And again, if you're watching and you have questions, you can also always tweet a question at me at Elise Who, ELISEWHO, and I will get it and ask to Dr. Lara Ray. So some of these things we've already covered, but somebody asks, are there any suggestions for teens that are addicted? So there has been some concern, or there are a couple questions about maybe a rise in underage drinking because everyone is stuck at home, and if there are alcohol supplies that you might be able to raid your parents' cabinet or your older siblings' cabinet, so stash. So what do you know about underage drinking, and if that is ticking up, or whether you, I guess, expect it to? And then any suggestions if you are the parent of a teen or a friend of a teen who might be doing a lot of underage drinking or trying it earlier than they otherwise would?
Sure. Well, what we know is that people drink less in the home when they are under supervision than they drink when they go to college, when they are less supervised, right? So that's when we see a lot of spikes in drinking at a young age. What I would emphasize is parental monitoring. And parental monitoring may really start with this approach we call stimulus control, of taking out the alcohol from the home. That might be a solution that your family may take, is saying, you know what, in our family, in our house, we're not going to have alcohol. That's a decision that you can make as a family to kind of reduce that likelihood. But parental monitoring and peer affiliation are two of the #1 predictors of underage drinking. If the parents are really closely monitoring, individuals are less likely to use, and if the peers don't use, individuals are much less likely to use. So, those levels of monitoring and peer affiliation should really be the focus of attention for families.
Okay, this next question seems like one of those that you can prepend with asking for a friend. How much is too much to drink in a pandemic?
In a pandemic.
Do we get a little bit more of a pass?
Yes, absolutely. What I want to say is that, these numbers are lines in the sand, but I use them for myself too. You had a difficult week where you exceeded your 7 if you're a woman, then maybe next week you look to get back under 7. And also we look that each episode don't comprise of more than 3 drinks, because for a female, 4 drinks or more constitutes a binge in a single day, in a single episode.
Wow.
And for men, 5 drinks or more constitutes a binge. So in addition to looking at the 7 and 14 numbers as kind of benchmarks, can we also look at not exceeding 3 for females and 4 for males in a single day? Those would be good benchmarks to aim for. But I'm with you. I am tired at the end of a long day, and I will have a glass of wine. But I found over time that having those numbers and those goals can really give you something objective. If we don't give something objective, sometimes we fail to help someone.
Okay, Lara, we have been ending all of these conversations with some tips, some takeaways that those of y'all who are watching now or watching the taped recording of this later can leave this conversation with? And I know that you prepared a couple in advance, and of course you can expound on it based or expand on it based on our conversation today. But what are some takeaways that you want folks to leave here with?
Well, the first thing I want to say is that we're all adapting. We're in this together, and you do have permission to cope. And we are here, together. UCLA, what I love about UCLA is that we're a science-based institution. So I want to share 3 points that are science-based that I think can be useful. The first one is a resource that I send to patients a lot, and it's called, we have a link to it that will show up momentarily, but it's called Rethinking Drinking. If you have more precise questions about yourself and your drinking and how it compares to other people, please check out rethinkingdrinking.niaaa.nih.gov. It's a fabulous resource paid by taxpayer funding, and I encourage all of you to consider looking at it as kind of a drinking check. How is that working? And also it has lots of great ideas for how to cope and reduce.
Fantastic.
Yeah, I love that resource. The second one is really more geared towards folks who need treatment. If you need formal treatment, you're thinking, okay, I listened to Dr. Ray and Elise, but how do I know if a treatment is good or not? Well, that's why we have alcoholtreatment.niaaa.nih. We call it the treatment navigator. It gives you a list of things to look for in the absolute best science-based treatments. It gives you questions that you can interview a provider, you can interview a treatment facility to really evaluate their capacity to provide you the services that are high quality and that you deserve.
Fantastic.
And then the final one, Elise, I want to plug in our laboratory. If you go to addictions.psych.ucla.edu, we have 2 resources. We have a clinical trial going on right now where individuals can receive medication and brief counseling to reduce their drinking. We also have a CBT clinic. CBT stands for cognitive behavioral therapy. And I'm really proud of this clinic. We can offer these services now remotely, but that's a low fee clinic in which we are providing evidence-based, scientifically based treatments for individuals with alcohol use disorder.
Oh, that's fantastic. So you could essentially be part of a trial, or or if not part of a trial, treatments that come through your center might be a little bit less expensive than a $250 an hour therapist, or is that what you're saying?
Absolutely. What we're doing is we're training these fabulous master's level clinicians to provide services, to provide a 12-week bout of cognitive behavioral therapy to individuals with an alcohol use disorder. And I'm really proud of our trainees. I supervise each and every one of them, and I think we're making a difference. So I really believe in what we're doing, and I believe in the power of change. I think people can change, and I wouldn't be doing this work if I didn't believe it.
That's fantastic. Well, we're also appreciative of your work and your expertise and your time. Dr. Lara Ray from the UCLA Addictions Lab, thank you so much.
Thank you.
And this time really flies by, and I hope that those of you who have been on here and missed anything can go back and watch. Of course, the taped conversation will be at ucla.edu/connections. Thanks to all of you for joining us. It's always a pleasure for me to moderate these conversations. And again, you can rewatch at ucla.edu/connections. My name is Elise Hugh from TED Talks Daily and NPR. Thank you for joining us.